Now, we're talking about open enrollment, but it's forcing the issue, is it not? That if an American does not have health care coverage, they are essentially breaking the law. Is that not correct?
If someone can afford coverage and has that option and chooses not to buy coverage, they will pay a fee on their liability
and it is a law, so therefore they are breaking a law.
Tax.
Okay, you also brought up the issue when you were in Kansas that you fought against discriminatory issues. Now, as far as the essential health benefits, correct me if I'm wrong, do men not have to buy maternity coverage?
Policies will cover maternity coverage for the young and healthy.
Including
under
men.
30-year-olds will have a choice also of a catastrophic plan, which has no maternity coverage.
The catastrophic, but the men are required to purchase
an insurance policy has a series of benefits whether you use them or not, and one of the benefits will be,
and that is why the health care premiums are
coverage,
increasing as high, because we're forcing them to buy things that they will never need. Thank you, Madam Chairman.
The individual policies cover families. Men often do need maternity coverage for their spouses and for their families, yes.
Single male age 32 does not need maternity coverage. To the best of your knowledge, has a man ever delivered a baby?
Lady's time has expired.
Now, understand when we're talking about the private exchanges or the private insurance, we are talking about 15 million Americans across the country. When we're talking about what percentage of those, maybe 50% will have their private insurance canceled. Because it does not, 50% will have their private insurance canceled. We don't know what percentage of those have it canceled because of the Affordable Care Act. The Affordable Care Act requires certain minimums of coverage in these plans. They need to cover, to make the risk pool functional, they need to cover things that each individual won't have. In other words, you may not be likely to have diabetes, but that type of coverage for medicine in there is going to be covered. Now, you will never, if you're a man who is single and will never get married, and you know you will never get married, and you will never have children, you will never need maternity care. But it is one of the baselines for insurance because it's the only way to spread the risk of those people who will need it. And so for that 32-year-old man, single man, at that age, their insurance is likely to go up. If you're under 30, you can get catastrophic insurance. If you're over 30, you can get exempted if you have lost a job, if you hit any other the reasons for exemption, which usually have to do with finances. If you are over 30 and you are making over $45,000 a year, you will get no subsidies. You will probably be paying more for your health insurance. The difference is your health insurance will be better, but nevertheless, you will be paying more for it. By the time you're 50, that won't be the case. We're talking about a very small percentage of people. And look, there is no doubt going through the private insurance industry is a Rube Goldberg contraption in some respects. And it would be much simpler to have everybody buy into Medicare. But the bottom line is, if that 32-year-old who's got only catastrophic insurance with a cap gets hit by a bus, gets taken to the hospital, has to declare medical bankruptcy. Remember, 50% of all, or 75% of all medical bankruptcies happen to people with insurance. Insurance in quotes. But they hit their lifetime cap or they hit their yearly cap. They go bankrupt. They can't pay their bill. We all pick up the tab. That's just the reality of it. But when you compare the amount of people who will be paying more for their health insurance, which will be a better product, versus the number of people who will not be getting health insurance because of Republican governors who will not expand their Medicaid, the first figure is dwarfed by the second. Dwarfed. So Renee Ellmers may have scored some points that we have lost some liberty in this country because 32-year-old men, single men, who will always be single, will have to pay more for their health care coverage and not necessarily socialize the risks of them carrying substandard health insurance coverage. It's really sort of meaningless and disingenuous.